And good morning. Welcome back. I'm Mabel, Jong. This is WHCC TV coming to you live from Washington, D.C. And we're going to continue our conversations with Joyce Knestrick. Dr. Joyce Knestrick is President, American Association of Nurse Practitioners. Good morning to you.
Hi, good morning.
Now, the role of the nurse practitioner, are you seeing an increasing number of people going into this field of medicine?
So we see many new graduates coming out this year. We have about a total of 270,000 nurse practitioners in the country now who practice in acute care and primary care, but the majority of nurse practitioners, about 80%, practice in the primary care environment.
How has the role of the nurse practitioner evolved?
I think that we have seen nurse practitioners primarily filling needs in primary care since our beginnings in the 1960s in pediatrics, working when there was a shortage of pediatricians. Nurse practitioner role evolved, but it was also evolving in other areas in terms of nurse intensivists that became nurse practitioners, which would be our modern day acute care nurse practitioner, but also as the needs for primary care started to increase in the country with the aging population and the changes in our healthcare system, we started to see the numbers of nurse practitioners grow to fulfill that need.
Okay. Are there some states that are more or that are better places to work for practitioners, nurse practitioners, than others?
So currently we have 22 states and Washington, D.C. that we consider full practice states. In other words, the nurse practitioner can practice without supervision or collaboration with another provider type. So they are licensed and they can practice. I would say it doesn't really change mostly how they practice, but their licensure is different. And so we see recently Nevada became a full practice state. We've seen an entry of more nurse practitioners than entering into Nevada to practice, and primarily in rural areas where they're much needed.
Is there a difference between a nurse practitioner and nurse full stop?
Oh, absolutely. Nurse practitioners are registered nurses before they become nurse practitioners. However, nurse practitioners have a bachelor's degree first, and then they enter into a graduate program. The graduate program is either at the master's or the doctor of nursing practice level, and so they build upon their skills as a registered nurse to become an advanced practice nurse, where they learn to diagnose, treat many variety of health conditions, and depending on the health population focus that they're in, would dictate their education. So they could be women's health, psych, mental health, adult geriatric, pediatric, and family.
Mm-hmm. A lot of decisions being made in the healthcare landscape do not include nurses being at the table. Do you think that should change?
Well, absolutely. The IOM report in 2010 strongly suggested that nurses at all levels be included and be at the table to make decisions about healthcare. I think as we look at moving into relative value payment systems that all look at health promotion and general health care of the population in the United States and then in the rest of the world, I think that that's the area that nurses really focus on, and nurse practitioners really focus on that in terms of caring for patients, not only to diagnose and treat illnesses, but also to help keep the population healthy. Mm-hmm. And I think in order to have a good healthcare system, nurses need to be at the table. We're the largest group mm-hmm. of healthcare providers in the nation, mm-hmm. and so we really need to be a part of the decision making.
And aside from being a part of the discussions, what else does the association want to see for the role of the nurse practitioner?
Well, we would like to see barriers removed to practice. In many of our states, there are artificial barriers in terms of licensure for full practice authority that really impact and create unnecessary money issues and unnecessary access issues for patients who want to see a nurse practitioner. And so eliminating those barriers to allow patients to have the high quality, cost effective care that nurse practitioners provide is really one essential element that we're really looking for in our organization.
Okay. So great to see you here, Dr. Knestrick. May I ask why you come to the World Healthcare Congress?
Well, I come here because I want to hear the latest information about what's going on in the healthcare of not only the United States but the world, but also to have that voice of the nurse practitioner be present in such a physician-centric model.
All right, Dr. Knestrick, thank you so much for your time.
Thank you very much.
And I'm Mabel Jong. Thank you for watching. Stay tuned. We have many more interviews to come.